As we transfer to a new president, every APHA president is unique and different from the person before them. I have had so many APHA presidents that have helped shape my lives, and it is my pleasure to welcome our new president, Dr. Shiriki Kumanyika. And as she comes in, I'd like to tell you a little bit about her. Shiriki is an accomplished academician at the University of Pennsylvania, where she's professor emeritus. She uses her interdisciplinary background to address the prevention of obesity and other diet-related chronic diseases and health disparities. In addition to her outstanding work at the university, she serves on numerous local, national, and international committees and advisory groups for the City of Philadelphia, the U.S. Department of Health and Human Services, the Institute of Medicine, and the World Public Health Federation and the World Health Organization. She's an articulate and passionate advocate for disease prevention. Please welcome Dr. Shiriki Kumanyika. There's an official action that we go through each year at this time. So, Shiriki, it is my honor to hand you the gavel. You're great. Thank you. Thank you.
Good afternoon, and welcome to this session, the closing session of this meeting, or perhaps the first session of the coming year for APHA. I would like to just say again that Joyce Goffin has been a model for what it means to be an APHA president. I have a different style, but I have to, she's going to be a very hard act to follow. It would be an understatement to say that this is a tremendous honor and a privilege to be your president. It's also probably the greatest professional and personal challenge I have taken on to date. I thank you for giving me this chance and for the many offerings of support that I've heard. Many colleagues have said, let me know what I can do to help you during your presidential year. And I really hope to be able to find ways to take you up on those offers. I'm a goal-oriented person, and so I've been asking myself for the past year, what would I like to see a year from now for APHA and for the nation's health? You know, what new developments could we see within a year? How much closer can we be to our goal of making America the healthiest nation? What will we have to do differently in order to have this happen? You know, how bold can we be to really move our agenda? And finally, what can I personally do in the role of your president to make this happen? As everyone here knows and probably can recite in their sleep, APHA has committed to making America the healthiest nation in a generation, and it's a long-term project. We're only in the starting phase of tackling this as a unified strategic initiative that will be the overriding principle of our activities. So in the year as president, I think, well, what can we accomplish? We won't see the long-term goal. We won't see the changes in morbidity and mortality. We won't see the achievement of health equity in this short time period. But by next year, we can focus on some goals, intermediate goals, that we will have to accomplish anyway in order to get to our ultimate goal. By next year, I think we can expand the vocabulary of the mass media, not only, but particularly health journalists, to include the slogan, the healthiest nation. By next year, and leading up to our Chicago meeting with the theme of health and all policies, we can make sure that more of our colleagues in the different agencies and organizations across sectors in the country are aware of our goal and that many have signed on to the goal and are helping us to meet it. But what I especially want to focus on during my tenure as president is to make sure that we can be tangibly closer to meeting the challenge of working with and working within the for-profit sector. This is a challenge that raises a combination of trepidation and fear, and you know fear can cloud our thinking, because there are potential pitfalls and risks, but it also raises excitement for its promise. It's at the core of the major challenges we face: climate change, health equity, how to be science-based and have the right evidence in the right place at the right time, holding people accountable for the public's health and holding ourselves accountable for the public's health, combating the effects of commercial marketing on health. So the challenge of engaging effectively with the private sector or the for-profit sector is a challenge that, if we can address it, it opens an incredible potential for accelerating our movement. But it's also a challenge that if we fail to address it, we're really on the path to failure, because we are not controlling many of the things that create ill health or health. The for-profit sector in almost all national economies is the major engine that produces the political and economic environment in which our health takes shape and in which our solutions must be embedded. So without losing sight of the reason for being of public health and for our reason for being in public health, we need to understand and exploit these forces for the benefit of the public's health. So I'll sum up by saying that I'm tired of being on the sidelines. I'm tired of just worrying and agonizing with like-minded public health colleagues about what the private sector or the for-profit sector is doing to the public's health. I'm ready to have the conversation and influence the outcome of the conversation. And so in return for your vote of confidence and your high expectations from me, I challenge you to join me in this effort.